Hundreds have died and thousands infected by the novel coronavirus worldwide. As medical experts try to stop the rapid spread of the virus and find a cure, the public needs to be protected by having the right information. Is the country equipped to fight the new coronavirus? We talk to newsmakers as we go on the record. Good evening. I'm Ruth Cabal. Our guests for this episode, World Health Organization Country Representative Dr. Rabindra Abising and Federation of Filipino-Chinese Chambers of Commerce and Industry President Henry Lim Bon Leong. Good evening, gentlemen, and thank you for joining us tonight.
Good evening. Oh, pleasure.
Dr. Rabi, I'd like to start with the figures that we have for the coronavirus cases. We have over 28,000 cases as of today and 565 deaths. And they're also reporting this is the biggest spike in the past few days. Why is that? Is the virus that aggressive, or is it just a matter of being more transparent in terms of reporting, sir?
I believe it's none of the two.
Okay.
It's probably because, as the Chinese authorities have informed, they are checking increasingly larger numbers of people. They're shifting on to the focus from screening severely ill patients to screening more patients with mild symptoms, as it becomes obvious that many people don't actually develop very severe disease. So the picture, if you see, is that there's a lot of screening going on because the testing is expanding, the capacity to test is expanding. And because of this, we are seeing increasing numbers. But this is also not the only reason. We need to also remember that we don't know everything about this disease. So there may be a lot of transmission also happening. But if you look at it, nearly 99% of this transmission is still
within
in China. And of that, clearly, the largest proportion is in Wuhan and Hubei province. So the transmission in other provinces of China is still pretty limited. And outside of China, though we've confirmed infection in 25 countries, I believe now, that's 200 cases, a little over 200 cases. The vast majority of that has been in travelers coming from China and from, again, Wuhan or Hubei province. So we need to look at this from that context. Having said that, there's also the situation where we have confirmed evidence that there is person-to-person transmission, both inside China and in other countries, particularly confirmed in Germany, France, Japan, and Vietnam, that there is person-to-person transmission among people who never went to China or Wuhan. So we have to take this in context. We are seeing also increasing rates of positives outside of China. So the daily increases were in the region of about 20 cases per day. But if we look at the last one, it's now 32 cases for the last 24 hours. So there is a slight increase in that number also, pointing to the fact that there is person-to-person transmission happening. We are making all precautions that are advocated, and many countries are practicing those. But as you can see from the countries I mentioned, even in those countries with relatively advanced capacities, there are person-to-person cases happening.
But how do you compare this to other coronaviruses, the spread of this new coronavirus?
So we have to look at it from a context perspective, right? The big coronavirus infections, there's actually 7 types of coronavirus which cause disease in humans. The common cold is also a coronavirus. But the big 3, as you would say, would be the SARS, or severe acute respiratory syndrome, which happened in 2002, and the Middle East respiratory syndrome, or the MERS-CoV, which happened in 2009. So comparatively, for SARS, way back in 2002, we didn't know what it was. We didn't know that it was a coronavirus infection till 1 month went. It was only after that that we identified the coronavirus and developed testing procedures. So for a month, we didn't know. In this case, we knew that it was a coronavirus by the 7th of January. The outbreak was determined on the 31st of December, so 1 week later.
Yes.
By the 11th of January, we had the full genome sequence. and labs were able to start testing on the 12th of January. So this confirms that capacities have improved across countries. We have better capacity to detect these kinds of outbreaks, and that has helped us to monitor more closely people getting actually infected with mild symptoms and severe symptoms. So if you look at the numbers, people say, oh, the number of novel coronavirus acute respiratory disease cases is bigger than SARS. But we didn't start counting SARS till a month was over, right? We didn't know that it was SARS. So we have to look at it in this context. We have to look at it in the context that many countries, particularly in this region, have been improving their preparedness and readiness capacities, including here in the Philippines, with the support of WHO and other organizations, precisely preparing for outbreaks of this nature.
Okay, well, we'll talk more about the virus in itself, but Sir Henry, I would like to ask you, because this concerns, of course, the Filipino-Chinese community here in the country, and do you feel some sort of stigma about the disease? And even the President Duterte is saying that, Filipinos should not be xenophobic.
Yes, Ruth, I've been interviewed quite a number of times regarding that there will be discrimination among fellow Filipinos regarding the Chinese. And there have been news that there are certain taxis, even Grab, whatever, that they refuse to take in Chinese-looking passengers. But these things are understandable. I said that what our countrymen are discriminating are not the Chinese, but the virus itself. And I mean, just for example, if you have a Filipinos coming from Wuhan and then want to take a taxi and then he coughs several times, I don't think the taxi driver will also take him. So it's not on the Chinese, but it's on the virus itself. So I just want to make it clear that we are not worried about any xenophobia, whatever here. We know that the Filipinos are very hospitable and all these things. So it's not, there's nothing that, in fact, what we are going, that we distributed so many surgical masks already.
Yes, I saw the
Even
pictures.
today, so every day you can see local Chinoys give out face masks, whatever, to all of these things, and we want to be part of the culture.
So you're not feeling that kind of stigma? I mean, as far as your group is concerned.
As far as I'm concerned, I mean, I was born here. I'm a third generation Chinoy. I went to Letran, I went to UP.
Yes.
I have so many classmates and all these things, and I know them. I know that this is nothing that we should be worrying about.
Okay, we'll talk more about this new coronavirus when we return. This is On the Record. Keep it here on CNN Philippines. Welcome back to On the Record. We're still talking about the novel coronavirus. Henry, I was asking you earlier if you feel some sort of stigma because of this new virus, but you're saying none, but in terms of the effect on business. Because I've been seeing pictures of Binondo, and there aren't a lot of people in Binondo in recent days.
Yeah, it so happened. It's so sad to know that this coronavirus happened during the Chinese New Year. And there have been a lot of cancellations of inductions, of parties. Even wedding has been canceled also. So definitely has an effect in business, especially the restaurants, also the tourism industry. I mean, we saw so many tourist guides now that who can speak Chinese suddenly out of jobs. But we are tapping them, we're tapping them because there have been Chinese who, for example, got sick and who want to go to the hospital.
True.
The hospital doesn't have enough, translators or interpreters. So we are using those tourist guides now to be on a 24 hours hotline to really servicing these patients, whatever.
You mean you're working with the health department? Because I remember Secretary Duque was saying at the Senate hearing that they were having problems because some of the hospital staff or even at the airport couldn't understand the Chinese who were coming in.
We already established a hotline already. In fact, it's out in the newspaper, Chinese newspaper, that they can call these hotlines if they're being admitted in the hospital and if they cannot get themselves across because of language barrier. We'll be ready to assist them.
Also, Henry, another issue that concerns the Filipino-Chinese community, the first fatality from the novel coronavirus infection here in the country has yet to be cremated. Health Secretary Francisco Duque tells CNN Philippines about the challenges that they faced.
We've been struggling. There are many groups who initially said they will cremate, they will bury in a Chinese cemetery, only to find out later on that they changed their minds and did not want to cremate anymore.
So did the DOH reach out to you for the Filipino community for help with this, or?
DOH did not reach out to the Federation itself per se. I do not know to which Chinese business community they reached it out. But then, we do our own investigations. Normally, of course, if you want to do cremations as a business, they will gladly accept it. But then all of them, not only the Chinese operated crematorium, but even the Filipinos, they are all in one saying that industry practice does not allow them to cremate people dying of infectious disease. So we want to clear it also with DOH. So whether that is really the norm, and DOH should come out and tell this crematorium that, this is not the practice that they should be. And then again, I was also telling them that you have two government crematorium, and one is in San Lazaro, another one is in the North Cemetery. Why don't you use the government crematorium? But I just understand maybe one was already out of order already for so many years. I do not know why they did not even fix it up.
So can I ask Doc Rabi, what's usually the procedure for this kind of things that?
So in the case of infectious diseases and whether it's a local death or a foreigner, usually what is the predominant thing is that you have to follow national rules.
Okay, and he's saying that the national rules say you can't cremate. The rules
say that you cannot cremate in commercial business establishments. But there shouldn't be a barrier for the body to be cremated in a government crematorium.
Yes.
But
will that have an effect? I mean, the man died Saturday, the 44-year-old Chinese male. Will that have any effect, or?
Ideally, the virus wouldn't be surviving so long in a cadaver. But we have to be careful, and we have very clear guidance that we have shared with the Department of Health, which are similar to the guidance that the DOH has, and we've asked that the death and the cadaver be sealed in a body bag because this is an infectious disease. We don't want to expose health workers and other workers to unnecessary threat.
Okay.
So I believe that angle has been followed. It's just the logistics of arranging the cremation.
Okay, Doc Rabi, I just want to know, because we were talking about this fatality. It's the first death outside China, and people were alarmed, of course, that it happened in the Philippines. But how deadly is the virus? I saw your presentation in the Senate. You were comparing it to other coronaviruses. Can you tell us about this?
Yeah, so as it seems, as I mentioned, we don't know a lot, but we do know that this coronavirus, the 2019 novel coronavirus, and the acute respiratory disease that it causes, doesn't seem to be resulting in very high mortalities. So if we compare this, for example, with SARS that happened in 2002, the mortality rates were about 14%. If you compare it with MERS-CoV, which happened in 2009, mortality rates were 34%.
Wow.
So you're talking here of mortality rates based on today's figures at about 2%.
Okay.
So we need to understand that things have also changed, as I mentioned before. Country capacities to manage these infections have improved because this is the third large coronavirus outbreak. So WHO has issued early on interim guidance on how to manage patients. Country capacities have increased. We are seeing 2% mortality in China because China has invested heavily in improving its capacity. And even after the outbreak, you've seen the construction of an unprecedented 1,000-bed hospital in 8 days. So this kind of access to resources and capacities has contributed to us seeing a 2% mortality in China. But as our Director General said, the rationale of why WHO declared this an international public health emergency is because we worry that if this disease spreads and starts to transmit locally in countries with access to less resources and lesser capacities, we may see higher mortality rates. So it's precisely to prevent that WHO is working in a coordinated manner to prevent further spread and control this disease.
Was that, I was reading yesterday, was that Timor-Leste who doesn't have like enough facilities for the quarantine of their patients, and they're asking other countries to allow them to,
I haven't seen that story, but I mean, there could be many countries.
To allow other countries
There could be many countries in those. We have a classification of countries based on their preparedness and response capacities, and we classify the most capable countries at a level 5, but then there are also countries at a level 1 with the minimum capacity.
So the Philippines is which level, sir?
Philippines is classified at level 4.
Which means that...
that you're reasonably well prepared in your preparedness and response capacities.
Okay. Another question is that a lot of people are thinking that it's like once you get the new coronavirus, it's like a death sentence already, that, you know, your chances to recover are very small, but many people in China have been recovering from this, right?
It's the panic that the infodemic of false news has been causing. If you, as I mentioned before, we are talking of a mortality rate of 2% now. We can compare that with many other diseases which have much higher mortality rates, right? We take seasonal influenza, for example. Last year in the US, we saw 35,000 deaths, right? This year for the flu season, the US has seen 8,000 deaths. This has caused only 565 deaths so far. I'm not saying that this is not a serious issue. This is a serious issue, that is why we need to work, but we need to look at it from a realistic perspective.
And that people can recover from it.
Yes, of course. The vast majority, 98% will recover. And what is even more important is that if the deaths you're seeing actually are happening among patients who have pre-existing medical conditions that actually make them weaker and reduce their immune capacities, and also people at extremes of age.
Right? Okay. We'll be back after a quick break, and we'll talk more about the novel coronavirus. This is On the Record. Stay tuned. Keep it here on CNN Philippines. You're watching On the Record on CNN Philippines. We're still talking about the novel coronavirus. Henny, I want to ask, you were mentioning earlier that some of your translators are actually helping the Chinese in case through a 24-hour hotline in case they want to go to the hospital. What else is the community doing?
We are trying to see whether actually we discourage also sometimes with you the other day with Yusek Eric Domingo, because it just happened that there is somebody who suspect of coronavirus in the hospital near the schools whereby. So the schools immediately imposed a 2 weeks suspension. And DOH was telling, that's a stigma. I mean, that's really too much. No, you don't have to do that. But then, of course, that's why we are trying to assuage the Filipino Chinese community. Because it so happens in China. And then every day they receive so many, WeChat news, whatever. And a lot of them are fake news also. So, they are worrying about all these things, and we're trying our best. And we are also saying that even for the face mask, I mean, Secretary Domingo was telling us that except the face mask for the hospital, right now, we cannot even import face masks. We import face masks from Vietnam because we cannot do any face masks from China anymore. Vietnam also stopped exporting the face masks. Taiwan also stopped exporting. The last one is Indonesia. Indonesia also stopped exporting. Can you imagine? So there might be a short supply of face masks if everybody would like to use face masks. These are the things that we would like. And of course, I heard from Dr. Rabi here, and we are trying to also disseminate the news that this is not really as deadly as what they perceive it to be in the Chinese WeChat, whatever.
Yes,
I don't know if it's apps of WeChat. No, WeChat has all these things coming out every day. Yeah.
Okay. Doc Rabi, I just want to ask you the new announcement of Health Secretary Duque that the new Clark City Athletes Village will be used to quarantine Filipinos from Wuhan. So I just want to ask, are there like some sort of standards or parameters to say that this is a good quarantine area, or did you assess that, or?
It's not in our mandate to assess it, but we've sort of worked with the DOH to help them determine what kind of precautions need to be taken. We need to realize that the repatriees are coming out of the epicenter, coming out of Wuhan, and they probably have a higher than average likelihood that they have contracted the infection. So it's necessary, and I just heard Secretary Duque, and I think it was Yusik Dulai mentioned that if these Filipinos that are coming out have clinical symptoms, they will be held back in Wuhan and treated at Chinese facilities. This is what China has been advocating even for other countries that did repatriation. So this is not a unique situation for the Filipinos. But it's also important to recognize that because of this risk that these people need to be held in quarantine, and held in quarantine meaning we now, based on current known data, we believe that the incubation phase, that's the period from the time they got infected to the time they become clinically symptomatic, is up to about 14 days. So the prescribed quarantine period is 14 days. So within that, for that 14 days, they will have to be held in isolation. We cannot run the risk of allowing them to mix with their families or the community at large, because it's very likely that if they have the infection, then you start local transmission. I want to reiterate again that you have 3 cases, but none of that was acquired locally here. All of those were travelers who came from China with the infection. So if we want to contain it that way, we have to make sure that we have clear procedures of bringing these people from the airport to this containment facility, making sure that the vehicles are disinfected, making sure that the people who are tending to those repatriees are protected and not exposed to infection, because clearly they'll need to have regular checkups, they'll need to have access to food and drink. So all of that I understood from the press release and the press con that all of that is being arranged. But it's critically important that those people are not put at risk by trying to care for their fellow Filipinos.
Thank you very much, Dr. Abby and Henry. That's the time we have. Sorry, no more time to discuss more. I would want to discuss more. Thank you very much to our guests. That's On the Record. I'm Ruth Cabal. Good evening.